Welcome to the Human 2.0 Sitting Disease webinar. First, I want to take a moment to thank you for purchasing this presentation about the negative effects of prolonged sitting. But next, I want you to take a moment to thank yourself for taking the time to improve your understanding of health and strategies for optimal wellness. This webinar is approximately 2 hours in length, and it has both a didactic component and a practical component, each about an hour in length. During this webinar, I will give you the background information from the research literature that explains the problems with prolonged sitting and sedentary behavior. I will also describe and discuss how these problems can be recognized and how they become apparent in the average person. You will be provided with simple, actionable recommendations throughout the webinar. And by the end of the webinar, you should feel knowledgeable about the sitting disease and feel comfortable implementing a plan to counteract its effects. We will provide you with a one-page cheat sheet as part of the resource package that accompanies this webinar. If you're looking for additional information or guidance, you can check out our workplace mobility guide that is available on our online shop for a nominal fee. This will supplement the video resources that we have available on our website and on our YouTube channel. If you want to keep up to date with all the content that we are creating, be sure to join our mailing list on the website found on the front page and subscribe to our channel on YouTube or our social media on Instagram, Twitter, or Facebook. And of course, if you have any feedback about the webinar after you've completed it, do not hesitate to let us know by filling out our feedback form or by email. We're always looking to improve the quality of our presentations, and your feedback helps us to do this. I'll just give you a quick little background about myself so that you understand why I have any expertise in this area of the sitting disease and its associated problems. My name is Dr. Chris Raynor. I'm an orthopedic surgeon and sports medicine physician. I practice in a community setting, meaning that I am not at an academic institution, although I do have an affiliation with the University of Ottawa. My practice is made up of approximately 50% sports medicine and orthopedic injuries related to sports. I also have 25% of my practice which is dedicated to arthroplasty and joint replacement of both the hip and the knee. And then finally, there is about 25% of my practice that is involved with trauma, whatever it is that may present. As an adjunct to my practice, I also perform insurance evaluations for motor vehicle injuries and for workplace accidents. And although I don't have a therapeutic relationship with those clients or patients, I do have a diagnostic role in helping them to determine the cause of their injuries or their pain. Consequently, in both areas of my practice, I see a lot of patients that present with some of the signs or symptoms of sitting disease and its associated problems. And although I'm a surgeon, much of my practice is dedicated to the diagnosis and the treatment of these particular musculoskeletal problems. That being said, I offer you the sitting disease and why you must change the way that you work. I always like to put this slide at the beginning of the presentation because it shows that although man has evolved from the initial hunter-gatherer all the way through multiple stages to the modern man, over that time frame, we have become more and more sedentary as we have more and more machines and computers and devices that will do the work for us. So although we have evolved from an intellectual point of view, over the many years, it seems that we have devolved from a musculoskeletal point of view. So this presentation will be broken down to a number of parts, and basically we're going to keep things relatively simple. First, I'd like to talk to you about the effects of sedentary activity, and I'm going to talk to you about things that you cannot see that are on the inside of the body. So basically, this is just the physiologic processes that occur on the inside. And these are very important processes. Unfortunately, we don't always pay attention to these things until they go wrong. That is, until you have to present to the doctor as a result of some problem, and then you need to undergo some form of treatment, or you need to start taking some type of medication. So this is going to be the first part where we talk about these processes that are on the inside. Then we're going to talk about things that are on the outside of the body that you can see or that you can feel. And it's not that these processes are any more important or any less important than the physiologic processes, but these are the things to which people more readily relate because they can easily see them or they can easily feel them. Generally speaking, when you consider physiologic processes, people don't necessarily know or are able to feel when their blood sugar is high or their blood pressure is high or their cholesterol is high. But you can certainly feel, or you are certainly aware, when you have back pain or shoulder pain or some other type of musculoskeletal complaint. So it's much easier for people to relate to these type of things because they are quite readily visible, or they are easily appreciated from a subjective point of view. Then I'll provide you with some general recommendations that will help you to implement a plan to counteract the effects of prolonged sitting. And finally, we'll show you some exercises that you can use as part of your movement plan throughout the day. And the exercises that we're going to show are all relatively simple exercises. They generally don't require any equipment. They only require a small amount of space. And we have designed all of these exercises so that they are something that you can do while you are in your office or while you are at work. So you don't need to have, or you don't need to be in a gym to do these. You just can do them at your desk. And they're not designed for you to get a workout from. They are just there to help you to integrate movement into your day. So you have to remember that the primary focus for the exercises in this setting is not for working out, but rather to get you moving and to counteract the effects of prolonged sitting. All right, so let's start with things that you cannot see. So this is the stuff that's going on inside of the body, the physiologic processes. There are a number of studies that show that as we age, the incidence of disease increases over time. So basically, as you get older, the likelihood that you may acquire any of a number of diseases will increase over time. We also know from a number of studies that as patients or as people age, the percentage of time during which they engage in sedentary behavior, or the percentage of time in which they are sitting, also increases over time. So this brings to mind the question, are these two things related? In a study that combines all of these three factors, the researchers found that when holding age constant, that the incidence of disease increased with the amount of sedentary activity, or the amount of sitting time. So in other words, sitting time is associated with an increased risk of disease outside of any effects that are associated with aging. Regardless of your age, the more you sit, the more likely you are to have some sort of illness. So let's look at this a little more closely. So this first table shows a number of chronic diseases, and it compares their relative incidences to one another. And it does this using sitting time as one of the causative factors. And so if we look at the sitting time across the top, as you move from left to right on the table, the amount of sitting time increases. So if you pick any particular disease, so for example, if we look at cardiovascular disease, which is shown on the bottom half of the chart and is highlighted in yellow, we can see that as we move from left to right, where sitting time increases from 0 to 4 hours to greater than 11 hours, we can see that the incidence of cardiovascular disease increases as the amount of sitting time increases. So as one goes up, so too does the other. But this is not just true for cardiovascular disease. If we look at any one of a number of other conditions such as diabetes, such as obesity, we see that this trend remains the same. As sitting time increases, so too does the incidence of that chronic disease. So this table would suggest that with metabolic conditions, sitting time is associated with an increased incidence of those problems. But it's not just metabolic diseases. If we look down to the table in the the bottom right-hand corner, we have a table that again contrasts sitting time with the incidence of chronic diseases, but in this case, diseases such as cancer. And again, if we look at the relative incidence of this disease, we can see that as sitting time increases on the left-hand side from 0 to 4 hours all the way to greater than 8 hours. On the bottom, we can see that the incidence of cancer increases. So the more you sit, the more likely you are to have this disease. So again, we see that sitting time is associated with an increased risk of illness in the general population. But both of these tables are talking about general risk within the larger population or within the general population. What about specific populations? If we look to the graph that is shown in the top right-hand corner, we can get a better answer to this particular question. And this graph is taken from a study that looked at sitting time and the associated illnesses in a particular population. This study was performed in the UK. If you're familiar with the buses there, they're double-decker buses. And consequently, there are 2 bus drivers or 2 bus personnel who are on these buses at the same time. One who is the driver who drives the bus, and then there is also the conductor or the ticket taker who would walk around the bus taking the tickets and checking the tickets for all of the people that were on the bus. So when they looked at this particular population of individuals, and when they matched these individuals for all things other than sitting time, they found that the incidence of disease was higher in those who were sitting for longer periods of time. In other words, the drivers who sat for the duration of their work shift had a higher incidence of disease than did the ticket takers, even when this population was matched for all other things, including age, race, sex, and a host of other factors. When all of these things were matched with one another, and the only difference being sitting time, they found that the drivers who had the higher sitting time had a higher incidence of disease than did the ticket takers who were walking throughout the day. So here I'm trying to get you to understand that whether it be in particular populations or in the general populations, overall, as sitting time increases, so too does the incidence of disease. And that could be both metabolic diseases or chronic diseases. So generally speaking, it's at this point in the presentation where I have a number of people who are quite active on a normal basis and they tend to work out regularly, that they start saying to themselves, don't worry, I got this covered. He's not talking about me because I work out on a regular basis. You would think that if you are working out regularly, that most of what I have to say would not apply to you. But this is the point in the talk where I point out to you that you would be wrong. And let me explain why. Physical activity and sitting are independent variables. So what does that mean? This basically means that their effects on the body's metabolism and on your health act independently of one another. So basically, this just means that even if you're active every single day and you're performing your activity in a concentrated manner, this still does not counteract the effects of prolonged sitting. To demonstrate this, we'll look to the graph shown here on this slide. Here, this graph is looking at glycemia in the top graph, which just means glucose in the bloodstream, and insulinemia, which is the bottom graph, which just means insulin in the bloodstream. And on the left-hand side of each graph, the amount of glucose on the top graph or the amount of insulin on the bottom graph increases from bottom to top. And as we move from left to right on each of these graphs, we basically move through time points during the day. So basically we have the morning on the left-hand side of the graph, and we have the evening and the night on the right-hand side of the graph. And on each graph, you have both a solid line, a dotted line, and a hashed line. The solid line represents people who sit for prolonged periods of time and who are not active throughout the day. The hashed line represents people who are intermittently active throughout the day. They don't necessarily do a big workout, but they are always moving throughout the day. The dotted line represents people who are regularly active, but who are concentrating their activity into regular workouts. And on the top graph, we can see that at any time point throughout the day, the hashed line is the lowest of all the lines. So in other words, at any time point during the day, people who are intermittently active are most likely to have a lower blood sugar than are people who are inactive throughout the day, and surprisingly, even people who are active on a regular basis, but who concentrate their activity into various workouts. So yes, you heard me correctly. Somebody who is intermittently active, but who does not do extended workouts on a daily basis will have a lower blood glucose at any time point throughout the day than will somebody who is regularly active but who performs that activity in concentrated bouts or regular 1 hour or 2 hour workouts on a daily basis. At any time point throughout the day, the person who is intermittently active will have a lower insulin level than will the person who is sedentary or the person who is regularly active but performs their activity on a regular basis during 1 to 2 hour workouts. This basically means that the effects of intermittent exercise are stronger and have a better effect than does regular concentrated activity. In other words, your body likes it better if you do many short periods of intermittent exercise rather than if you did one period of concentrated exercises each day. But why does this matter? Glucose is the energy molecule for your cell. It is the gasoline that powers the engine in each and every cell in your body. Insulin is basically the key that tells each of the cells in your body to start taking glucose that is in the bloodstream out of the bloodstream up into the cells. High glucose levels and high insulin levels are a problem. High glucose levels are associated with damaged organs, fatigue, excessive thirst, excessive hunger, poor wound healing, and a number of other issues. High insulin levels are associated with diseases such as diabetes, coronary artery disease, high blood pressure, weight gain, obesity, etc. So basically, you don't want either of these things. And the more intermittent activity you engage in, the less likely you are to have either of them. So I like to include this infographic here just so that people can understand the extent to which sedentary activity can affect them on a daily basis. And here we have listed many of the diseases that are associated with prolonged sitting or sedentary activity. Many systems of the body are represented here, including metabolic diseases, cardiovascular diseases, pulmonary diseases, cancers, neurologic diseases, musculoskeletal disorders, and quality of life issues, as well as a host of other problems. So we can see here that the extent of these effects is far-reaching, and that sedentary activity is not such a simple problem. So this is a great opportunity for us to stop for a moment and to take a break, because after all, we practice what we preach. So we're going to take a short break to do some of the exercises that we have in our exercise library. And these are exercises that you can easily do when you're in the office setting. Hey everybody, so this is the first movement break. And we're just trying to move because we've been sitting for a long period of time. And so we're just trying to get a little bit of motion in our muscles and in our joints. And this is not supposed to be a workout. So the first exercise that we're going to do is the neck roll and the neck rotation. So basically, if you're in a standing position, all you're going to do is first you're going to just tilt your chin down to your chest and bring that as far as you can. Then you're going to look up to the ceiling as far as you can and bring it back to the neutral. You're going to look over your left shoulder as far as you can and then over the right shoulder as far as you can. And then what we're going to do is we're going to try to put some of these movements together. So first we're going to look over to the right hand side and then roll our head around to the left. Then we'll look over to the, did I say right? No. Look to the left, roll to the right. And then we're going to look to the right and roll to the left. And same thing, look to the left and look back. And then look to the right and roll back. And then we can put them all together to roll down to the front, up to the back, and then reverse direction. All right, so that's the neck rotation and the neck roll. So the next exercise that we're going to do is the chest opener, and this is basically because we've been sitting for a long period of time and we have been allowing ourselves to fall forward into a slumped posture, closing down our chest cavity and decreasing the amount of space that's available for our lungs to expand. So now we're going to reverse that by opening up the chest. And so basically, from a standing position, feet shoulder width apart, all we're going to do is bring our hands out to the side and reach back as far as we can and expand with a big deep breath and then relax. And again, and really try to reach back as far as we can with our hands, pulling our shoulder blades together so that they touch at the back, and relax. And again, and when we're reaching back, we're really trying to expand the rib cage, lift the rib cage, and to open the rib cage. So think about that as you bring the arms back. We're not just reaching, but we're also expanding. So out in front, back. And one more time. Excellent. Nice work. So the next exercise that we're going to be doing is the hip hinge. And so for this, if we start with our feet just shoulder width apart or a little bit wider than shoulder width apart, basically all we're going to be doing is bending at the waist. But we don't want to just bend forward. We want to transfer our center of gravity back so that we are on our heels. And what that is going to cause us to do is to protrude or direct our butt towards the back. And so if you look at it from the side, I'm not bending forward and allowing my center of gravity to fall forward of my feet. I'm trying to keep my center of gravity over top my feet. So I'm going to bend, but at the same time, push my butt back. So we're just going to do a hip hinge. And if we were lifting weight, this is the same manner in which we would do a deadlift. So all we're going to do with the hip hinge is, as I said, bend at the waist, stick the butt back. You're going to pretend as if you had a bench in front of your legs and it wasn't allowing you to bring your legs forward, okay? So from the standing position, we're just going to come down and we're going to reach towards the floor, so we're pushing the butt back. You should feel a little bit of a stretch in your hamstrings here behind, and then back up. And you want to pretend as if you have 3 points along the line, A, B, and C. And when we go down into the hip hinge, you're basically pushing B back, but you're trying to keep A over C. And then when we come back up, all you're trying to do is bring B back in between A and C. All right, let's do a couple more repetitions. And down again. Try and keep the back straight. We don't want the back to curl over, so we're trying to keep the back flat. And back up. 2 more. And back up. And back up. So that is the hip hinge. So now that we've taken a moment to move and to incorporate movement into our day, let's get back to the talk. So we've been talking about physiologic processes, or the things that you cannot see that are on the inside of your body. And I hope by this point I've helped you to understand that prolonged sitting or long periods of sedentary activity are associated with a higher incidence of medical problems. But we're going to shift gears now and talk about things that you can see and or the things that you can feel. I like to show this pictogram at this point because it shows a number of the most common medical or musculoskeletal problems with which people present to an orthopedic surgeon or a sports medicine physician's office. And generally speaking, with only these 4 problems, if I poll the audience, I can usually have almost all, if not all, of the audience members raise their hand when I ask, have any of you had any one of these problems at any time in your adult life? Just from that simple question, we can see that musculoskeletal problems are quite common. But what do these have to do with prolonged sitting and inactivity? Well, let's talk about that. Well, here's something that we can all relate to. We all have a certain degree of vanity, and we all are concerned to some extent with our own personal appearance. And generally speaking, as we age, we tend to put on a little bit of weight, and we tend to not be as slim as we were when we were younger. And here we have a graph that's taken from a study where they looked at a number of physical traits that they compared against activity levels as determined by the amount of sitting time. And on the left-hand side of the graph, we have waist circumference, which increases from top to bottom. And on the x-axis of the graph, we have activity time, which increases from left to right. So in other words, as we go from left to right on the graph, activity time increased and sitting time decreased. Those who sat for extended periods of time are on the left-hand side of the graph, and those are called prolongers. And those who took intermittent breaks and were active throughout the day are on the right-hand side of the graph, and they are called breakers. And we can see here that when all other factors are matched, such as age, sex, smoking, etc., we can see that the waist circumference of those who were sedentary for extended periods of time, or in other words, prolongers, was significantly larger than was the waist circumference of those who were intermittently active, or in other words, breakers. So all other factors aside, the more often you take breaks and the more active you are throughout the day, the smaller your waist circumference is likely to be. So if you want a smaller waist, you need to move more frequently. Sit less, move more. Okay, well, how else does prolonged sitting affect the average person? Generally speaking, if you were to look at somebody as they were sitting at their desk throughout the day, at the beginning of the day, you might see that person sitting tall and at attention. But as the day progresses, generally speaking, they become more tired and they tend to slump further back in their chair and to protract their shoulders and hunch their shoulders forward more often than not. And studies have shown that the slump posture is associated with decreased lung potential. In other words, your ability to bring air and oxygen into your lungs is decreased by prolonged sitting and a slumped posture. The ribs are attached to the spine in such a way to allow them to move in a hinged fashion. So when you inspire, the ribs open up, increasing the capacity of your rib cage or your thorax and creating negative pressure in your lungs, which sucks in air into the lungs. The larger your rib cage can expand, the more air and oxygen you can bring into the lungs at any one time. Any process which decreases the ability of the chest to expand also decreases the amount of air that can be brought into the lungs, and by virtue decreases the amount of oxygen available for the lungs at any one time, because the air is only 21% oxygen. So what this means is that if you sit with a poor posture or sit with a slumped posture, your rib cage will have a decreased ability to open up, and you will have a decreased ability to bring air and oxygen into the lungs. This posture can be associated with lightheadedness and a decreased level of cognitive function. And all this means is that you're going to have a decreased ability to concentrate and or focus while you're sitting in this position. Removing the backrest from your chair, however, can help to counteract this problem because it causes you to sit in a more upright position and restores the normal lordosis to the lumbar aspect of your spine. And lordosis just refers to the type of curvature that is normally present in your lumbar spine, which is a curve with the convexity or the bump prominence of the curve pointed towards the front. So the take home here is that prolonged sitting is usually associated with a slumped posture, which is also associated with decreased ability to inspire or intake air and oxygen into the lungs. And ultimately, this results in lower concentration and lower focus at work. So here you can see that on the left-hand side, we have somebody who is sitting in a slumped posture, and you can see that rather than the normal 4 curves which should be present in the spinal column, we can see that largely there are only 2 curves. Likewise, with panel B, we can see that as somebody who is sitting at work and they're concentrating at their work and they have their head and neck in a forward flex position, we can see that again there is largely only 2 curves in the spinal cord, or pardon me, the spinal column, where there should normally be 4 curves. If you look to panel C, you can see the representation of somebody who is sitting at attention, and here we can see the normal 4 curves of the spinal column. 2 lordotic curves and 2 kyphotic curves, or in other words, 2 curves point towards the front and 2 curves point towards the back. And finally, in panel D, we can see here the appropriate posture for somebody who is sitting. And basically, this person is demonstrating what we call the slant body position, which is a technique which is used for people to remain attentive while they're sitting for extended periods. And this is basically an acronym which stands for sit tall, lean forward, ask questions, nod, and to track the speaker. And as I said, this is just a technique that is used to keep people attentive when they're sitting during didactic sessions. And basically, this is just a technique which allows someone to remain sitting in a position that maintains the adequate curvature of the spine and allows them to maximize their ability to breathe and concentrate and remain focused. Okay, so this is another opportunity for us to get up and take a break and to move around, and then once again to incorporate some movement into our day-to-day routine. Okay guys, so now we're here at movement break number 2, and again, this is another opportunity for us to just introduce a little bit of movement and get our body out of that static position. So the first thing that we're going to do is we're just going to do some head tilts from side to side, and we're just going to add a little bit of tension just so that we can help to stretch out some of the muscles in our neck that have been contracted in one position for an extended period of time. So all we're going to do is tilt, a little bit of a lateral tilt first to the right hand side, and a little bit of gentle pressure back to neutral, and then over to the other side. Just a little bit of gentle pressure. Again. And then one more time. And then if you want to change up the angle of the stretch just a little bit, you can turn your head a little bit as you tilt it. And that'll help you to reach a little bit of a different angle and some different muscle fibers in the neck. And back up to the middle. So that's the head tilt. So the next exercise that we're going to do is the alternating shoulder circles, and this is a great exercise for shoulder mobility, and this will also help you to get your brain thinking and firing. So basically with this one, you're going to start with the hands together in the front, and then we're basically going to go different directions with each arm. And then you can reverse. And back up to the middle. So that's the arms, alternating arm circles. So the next exercise that we're going to do is the ostrich stretch. And for this one, basically we're going to, it's as if we were doing half of a deadlift and then a stretch on the opposite side. So basically we're going to keep one leg straight. Okay, this is the leg that we're going to be stretching, and the other has a soft knee with a bent leg. And basically we're going to reach down, we're going to do that hip hinge again, reach down, sweep the floor, and then we're going to switch feet. Sweep the floor. One more rep each side. And back up. Okay, now let's shift gears again and let's look a little bit at the musculoskeletal system. So I've shown you here some anatomy diagrams, and I don't want you to be overwhelmed by the amount of terminology that is on these diagrams or the complexity of these diagrams. There's no test here, and you do not need to remember all of these terms. If we first look to the left-hand panel, what I want you to see here is that there are a number of structures which are shown in yellow, and these represent the nerves that are present in the posterior or the back area of the head and the neck. I also want you to look at a number of the red structures. These represent the blood vessels which are present on the back area or the posterior aspect of the head and the neck. And what I want you to first notice with these structures is that they are quite small. And if we were to measure them, we would see that the blood vessels and the nerves are only 1 or a few millimeters in diameter. And I want you to also note that these structures pass in and around or through the various muscles that make up the area at the back of the neck. I also want you to pay attention to the fact that the muscles are present in layers. There are a number of layers of muscles that are present to help with the positioning of the head and the neck and to help move the head and the neck in conjunction with the muscles of the upper back and the shoulders. But what's really important here is the fact that the nerves and the blood vessels are quite small in comparison to the muscles. The ability to stretch and or move the blood vessels and the nerves is quite limited. In other words, they really can't be moved that far or compressed that hard before problems start to occur. When talking about the head and the spinal column with patients, I often compare them to a bowling ball and a broom handle. The head is a round structure which accounts for approximately 10% of the body weight. It is stuck on the end of the spinal column at the very top. And this is much the same as having a bowling ball at the top of a broom handle. If I were to hand you a bowling ball that were stuck on the top of a broom handle, and I were to ask you to hold that in one hand, you would find that it would be much easier to hold the bowling ball in position if it were positioned directly over top of your hand. However, if I asked you to move that bowling ball away from the base or away from your hand, you would see that the more you brought that bowling ball away from the base and away from your hand, then the more difficult it would be to hold that bowling ball upright. The same is true for your head and your neck. If the head is directly over the broom handle or directly over top of the spine, it will be much easier to hold it in an upright position. The more that you bring the head away from the spine, i.e. by having the head in a forward flex position, the harder it is to maintain the position of the head in space. The further that the head gets away from the base, the harder it becomes. But what does this have to do with the nerves and the blood vessels of the posterior aspect of the neck? Well, I said to you before that these structures have very small or very tight tolerances, and they cannot be stretched or moved or compressed very much without problems occurring. Because these structures travel in, around, and through the muscles of the neck, if the head is positioned away from the base of the spine, the muscles that control the position of the head and the neck and the shoulders have to work much harder in order to maintain the position of the head and the neck. And this means that those muscles have to contract harder and they become more rigid than if the head were positioned in a more optimal position. And it's not hard to imagine that if the muscles of the head and the neck area are contracting more tightly and are more taut, then the structures passing through, around, or into these muscles will also be compressed more heavily. The harder that you squeeze the nerves and the blood vessels that are running around the posterior aspect of the neck, the more likely you are to alter the function of those structures. And this will manifest itself as pain or headaches or decreased function or muscle spasm or a host of other problems. And here we just see a number of common musculoskeletal complaints that are associated with poor posture and prolonged inactivity. So let's move on to the shoulder. And once again, I don't want you to be overwhelmed by the anatomy and all the terminology. Basically, what I want you to see is just the complexity of the shoulder and all of the structures that are involved with helping it to fulfill its role and its function. And again, we see, if we look at the panel in the middle, we can see from this diagram the structures that are shown in yellow, and these represent the nerves of the shoulder. And they are arranged in a bundle which is known as the brachial plexus. And the brachial plexus travels down from the neck, through the muscles, and down underneath the arm. And the brachial plexus is involved with all of the motor function and all of the sensory function of the upper extremity. In other words, of the arm, the hand, and the fingers. And as with the neck, these nerves travel in, around, and through the muscles of the upper chest and of the upper extremity. And just as with the head and the neck area, if the muscles of the chest, upper back, shoulders, and arm are not functioning properly, this can have an impact on the nerves and the blood vessels of the upper extremity. The more tight and rigid these muscles become, the less likely they are to move, and the more likely they are to compress the structures of the blood vessels and the nerves, thereby altering the function downstream of the area of compression. I often have patients who present to my office with numbness and tingling in their upper extremities, and they arrive with MRIs of their cervical spine. These are often normal, and the patient and their physician have been unable to determine what is the cause of the altered sensation in the upper extremity. And oftentimes it has nothing to do with the head and neck, but more has to do with the posture of their scapular region or their shoulder region. And once we correct that, we're able to eliminate those symptoms that they present with. If you look to the top right, you can see that there is a diagram of the scapula or the shoulder blades as they sit on the back of the thorax or the chest cavity. I often say to patients that the scapula is the stage upon which the shoulder performs. And this is quite rightly so, because the position of the scapula determines the overall function of the shoulder as a result of its ability to position the shoulder in space. If you look down to the bottom right corner of this slide, we see a couple of pictures of a man, both from the back and from the side. And we can see here that the top two pictures go together and the bottom two pictures go together. Let me explain. So often I have a lot of patients that are referred to my office as a result of a potential diagnosis for frozen shoulder. Frozen shoulder is basically a problem that is associated with a painful decrease in range of motion of the shoulder. It's a problem that comes on for unknown reason, and generally it runs the same course no matter what we do to it, which is approximately 18 months to 2 years of painful immobility of the shoulder, which resolves on its own over time and eventually allows the patient to come back to normal range of motion that is pain-free. So I have patients that are often referred to me with this problem, and when I look at the patient and do a physical history and a physical exam, oftentimes I see that it is not actually frozen shoulder that they have. And the bottom two panels of the right-hand corner picture represent this. So here, if we look to panel C, we have a gentleman who is positioned with his back to us. And we can see here that his shoulder blades are both protracted, meaning they are extended towards the front of his body, and they're elevated. So in this position, the scapula is now tilted forward on the rib cage. Normally it is positioned in a retracted position and it sits completely upright, but here we can see that it has rolled forward over the rib cage. So how does this cause a problem? Well, I said that the scapula holds the shoulder in place. The flat portion of the scapula rests on the back of the rib cage, but there is a portion of the scapula which arises from its spine, which curves around to the front, and this is known as the acromion. Because the scapula is one solid piece, as the scapula is elevated and it is protracted forward, that acromion goes from an upright position into a more curved and hooked position. And so if somebody has their shoulder blades in a protracted and elevated position, when they go to raise their arm, they will find that there is a mechanical block as the bone of the humerus or of the upper arm bangs into the hooked acromion as it is tilted forward. So when we look to panel D, we have someone who had a potential diagnosis of frozen shoulder, which was a painful loss of movement of the shoulder. And when that person tried to raise his arm, when the scapula was in a protracted position, we see that he was unable to get his arm entirely overhead, and his range of motion was limited. However, when that patient had his shoulder blades positioned appropriately, which is in a depressed and retracted position, and then he went to raise his arm, we could see that he was now able to obtain a full range of motion. And so it was not that he had frozen shoulder, but rather that he had poor periscapular posture, which controlled his, or limited his ability to engage in a full range of motion of the affected shoulder. So what does this have to do with sitting? Well, recall that with prolonged sitting, people tend to sit in a slumped posture. Their shoulders tend to be protracted and elevated, and their cervical spine tends to be forward flexed. Therefore, it should come as no surprise that this sitting position is often associated with an increase in shoulder pain symptoms. And now we can begin to understand why, both as a result of altered function of the brachial plexus and poor periscapular posture. And here I've just listed a number of the common musculoskeletal complaints that are associated with poor periscapular posture and prolonged sitting. So let's stop again for a quick break and to interject some movement. Okay guys, welcome to movement break number 3. So now we're going to go back to the shoulders and the scapula. So after we've been sitting for an extended period of time, we tend to hunch up our shoulders and protract them forward. So now we're really going to be concentrating on scapular movement. And for this, basically, we're going to start out, and first you're just going to lift the shoulders up to the ears as far as you can, and then drop them down to the floor as far as you can. Then we're going to bring the shoulder blades forward as far as you can, and then back as far as you can. And then we are going to put those all together. Up, forward, down, and back, up, forward, down, and back, up, forward, down, and back. Now, we're going to reverse this, but I really want you to concentrate when we're doing this on bringing those shoulders as far back as possible, as high as possible, as far forward as possible, and then towards the ground as much as possible. So for 3 repetitions, it's going to look like this. And that is the shoulder rotations. And again, this is a great exercise for restoring scapular control and getting the scapula to move around the thorax or around the chest cavity or chest cage. The next exercise we're going to do, you can do in a seated position, and this is just to help you to engage your core and to help the hip flexors, which have been in a statically shortened position, but now we're just going to introduce some movement to those muscle groups and also some work on activation of the muscles and control of the muscles. So what we're going to be doing is basically a seated leg lift and an isometric hold. So up, 2, 3, 4, 5, and then back down. 1, 2, 3, 4, 5. And when we do this, we want to try not to lean back. We want to try to sit in an upright position, and we just want to try to do this unsupported. So up, 2, 3, 4, 5. Up, 2, 3, 4, 5. And if you want to make it a little bit harder, 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. And that's the seated leg lift. So the final exercise for this exercise break, or this movement break, is going to be a seated chair twist. And we want to try to do something to introduce a little bit of rotation into the thoracic spine. We spend a lot of time working on both flexion and extension of the thoracolumbar spine, or the spine of your chest and your low back. But we really don't spend that much time doing lateral bending or twisting. So now we want to add an element of rotation. And so for this exercise, all you're going to do is you're going to turn, keep your butt on the chair, keep your pelvis towards the front, your feet towards the front, and you're just going to turn to one direction, grab the back of the chair, and twist yourself to turn towards the back as much as you can. Hold that. 2, 3, 4, 5, and then to the opposite direction. 1, 2, 3, 4, 5. Back again. 1, 2, 3, 4, 5. And again, 1, 2, 3, 4, 5. And as you do that, you'll find that you'll become more mobile, and you should be able to turn further and further towards the back. That is the chair twist. And as you do that more and more, you're going to find that you become more mobile, and you should be able to turn further towards the back with each repetition, and you'll feel comfortable, more and more comfortable, holding it for longer and longer periods of time. Okay, so now let's get back at it, and let's move on to the lower back. If you look at the spinal column, you will note that the vertebrae at the top are much different than those at the bottom. You will see that the vertebrae at the bottom are much larger, much taller, much stouter, and basically more robust in appearance than are the vertebrae at the top. And this just makes sense because at the top, the vertebrae of the cervical spine have only the weight of the head and the neck to accommodate. Whereas down below, the lumbar vertebrae have the weight of the head and the neck, the upper extremities, and the thorax to withstand. So it makes sense that they will be larger or more robust than the vertebrae higher up. In addition, we can see that the muscles of the lumbar spine are much broader, much stouter, and much stronger than are the muscles that help to control the upper spinal column. And again, this is for the same reasons that the vertebrae are larger down below than they are up above. So if the spine is already designed to take these factors into account, then what's the problem with prolonged sitting? Or is prolonged sitting even a problem at all? And here we basically have a chart which shows on the left-hand side the amount of force that is seen at the third lumbar vertebrae in various different body positions. At the most left-hand side of this graph, we can see that the body is basically, or that the third lumbar vertebrae sees approximately 25 pounds of force when you are in the supine position. So that's basically the lowest level of force that is seen by the disc, and that is in the supine position when you are laying flat on your back. Just by turning onto your side and in the side lying position, the amount of force that is seen by the lumbar vertebrae is tripled. It goes up to 75 pounds of force. Once you are finally standing in an upright position, that goes up to 100. So that's 4 times what is seen at that vertebral disc when you are laying on your back. And as soon as you start to lean forward, then that increases to 150 pounds of force. And if you are lifting an object of approximately 20 kilograms or 40 pounds, then that force goes up even higher. Interestingly enough, oftentimes when I see patients in my office and they are sent to me for assessment of low back pain. I'll do a detailed history and a physical examination, and as part of the history, I'll ask these patients what they're doing throughout the day. And in many cases, a lot of these people are, doing, they may be doing physical jobs, physical labor, or they may be doing jobs that require them to be standing for an extended period of time. And so they'll often tell me that at the end of the day, they come home and they like to sit down on the couch so that they can take a load off their feet because their back is tired from being standing all day. But if we look to this diagram, we can see that even when sitting in an upright position, we can see that the third lumbar vertebrae, the load that it sees is actually higher than it is when the person is standing upright. If the patient slumps forward or sits with a slouched posture, then we see that force increases even more, up to 185 kilograms of force on the spine, or on the third lumbar vertebrae. And finally, if they're slumped forward and picking something up off the ground, we can see that yet again the amount of force seen at the third lumbar vertebrae increases substantially. But more importantly, it is increased almost 12 times what it is when the person is laying supine, and it is raised almost 3 times what it is when they are just standing in an upright position. People think that they're actually relaxing at the end of the day and taking a load off their feet. They're not really taking that much of a load off their spine, and in fact, they're increasing the load on their spine, making their back work harder. And while it is true that the vertebrae of the lumbar spine are more robust and more resistant to the increased loads than are the vertebrae of the thoracic spine or the cervical spine, we can see that it's the intervertebral discs where most of the forces that are transmitted through the spinal column, it's these discs where most of these forces are absorbed. And it's the discs where the problems arise if you are sitting for extended periods of time, and more importantly, sitting in a slumped position or with poor posture. If we look at the pictogram here on the left-hand side, we can see the intervertebral disc of the lumbar spine in both the lordotic posture and in the flexed posture. So the lordotic posture, in other words, the posture where the curve of the lumbar spine is directed towards the front of the body, this is the normal posture that we would see in the lumbar spine. The flexed posture is the posture that's associated with prolonged sitting and sitting in a slouched or a slumped position. And when we look at the top of the pictogram, what they're showing here is the amount of fluid loss that occurs in these intervertebral discs over a given period of time. And basically, the discs are a rubbery or malleable structure that helps to cushion forces in between various vertebrae of the spinal column. And in order for these discs to maintain their ability to accommodate force, they need to be compliant. Compliance of the intervertebral disc is a function of their water content and the amount of fluid that they hold. As we age, these discs become less compliant as a result of decreased ability to retain fluids, and they become more easily damaged as a consequence. So ideally, we want to maintain the fluid content of the intervertebral disc as high as possible for as long as possible. And we can see that in the lordotic posture or the lordotic position, the amount of fluid loss of the intervertebral disc is relatively symmetrical in both the front and the back of the disc. And when we compare this to the amount of fluid loss that occurs as a result of the forward flex posture, we can see that the amount of fluid loss is increased substantially as a result of the forward flexed position. And that's just because this position puts an additional level of stress on the disc. And so the amount of fluid loss is increased over a given period of time. In the bottom of the pictogram, we can also see that during that same time frame, the ability or the amount of solute that is able to diffuse back into the disc is quite different when you compare the lordotic versus the flexed posture. And we can see that with the normal or lordotic posture of the lumbar spine, the solutes are more readily able to diffuse back into the disc, and the amount that is able to diffuse into the disc on the front and on the rear of the disc, or the anterior and posterior sides of the disc, is more symmetrical, as opposed to the flex posture, where we can see that there is quite a difference between the amount of solute that is able to rediffuse back into the disc when you compare the front of the disc to the posterior aspect of the disc, leading to an imbalance in the compliance of the disc from one side of the disc to the other, and therefore leaving that disc more susceptible to injury. If we look at the diagram on the right-hand side, this is basically, again, a diagram to show you the anatomy of the lumbar spine the anatomy of the spine and the muscles that are involved with stabilization of the spine. And here you can see that as within the other levels or other areas of the body that we have already shown, there are a number of different layers that are associated with control of the spine and a number of different muscle groups. Note that the muscles that are associated with control of the spinal column higher up are generally smaller in size as compared to the muscles lower down, which tend to be larger in size and with broader areas of insertion. Again, here I've listed a number of the potential musculoskeletal problems localized to the low back that are associated with prolonged sitting. It's important to ask the question of whether these effects are related to the low back itself, or are there any other contributors to this problem. Interestingly enough, it is not just the muscles in and around the low back that contribute to the problems associated with prolonged sitting. There are other muscle groups that are present in the lower extremity which play a role in the presentation of pain symptoms in the low back and which contribute to the problems associated with prolonged sitting and poor posture. And here we've just shown some of the anatomy of some of the lower extremity muscles that are involved. And this includes the muscles on the left-hand side of the hamstrings, which are on the back of the thigh. It also includes the iliopsoas, which are two muscles that connect the the trunk to the lower extremities. And it also includes the muscles below the knee on the posterior aspect, the gastrosoleus complex, or the soleus, and the gastrocnemius, or the calf muscles. When I describe to patients how these muscles contribute to the stabilization of the spine, I ask them to envision in their mind driving down a country road and looking off into a field to see a cell phone or a radio tower. And the features that you'll note are that the tower is very tall and slender, and it is stabilized by many, many guide wires, which are attached to the tower and then anchored to the ground in various locations. And there are guide wires that are used to stabilize the tower in all directions, north, south, east, and west. And likewise here, the spine is like the radio or cell phone tower. And the muscles that help to stabilize the spine are like the guide wires. So in order to stabilize the spine appropriately, you need to have guide wires or stabilizing muscles in all directions, north, west, east, and south, more specifically anterior, posterior, medial, and laterally. You need to have stabilizers in all of those planes or directions. All of these muscle groups contribute together to maintain the stability of the spine and to help control the movement of the spine in each of the various planes. In the sagittal plane, or when looking at the pelvis from the side, it's best to think of the pelvis as a teeter-totter. with the hip joint being the fulcrum or the point of balance for that teeter-totter. All of these muscles that contribute to the stability of the spine attach onto the pelvis, and they rotate over the hip to help control the orientation and the stability of the spine. And on both sides of the pelvis, both front and back, or anterior and posterior, there are muscles both above and below which help to move the pelvis and therefore balance the forces that are acting on the spinal cord or spinal column. Based on the activities of these muscle groups, this will determine the relative lengths of each of the muscles that are attached to the pelvis in the various locations, front and behind. Generally speaking, prolonged sitting will shorten the distance between the abdominal muscles and the symphysis pubis, or the top of the pelvis in the front. This serves to bring the front of the pelvis up towards the belly button. Consequently, this serves to lengthen the muscles of the lumbar spine, putting them under tension. And because of this position, this tends to shorten the hamstrings over time. Patients who present with musculoskeletal complaints as a result of prolonged sitting will often complain of pain in 3 areas. Number 1, the low back, because the low back muscles are constantly under tension and they have been lengthened. They're really working hard to do their job of stabilizing the spine, but they're doing so from a position of mechanical disadvantage because they have been lengthened. Number 2, they'll also have pain in the back of the legs or in the hamstring group. And this is because these muscles have been shortened over time as a result of the tilted pelvis. And the pelvis, which really wants to be level, is constantly putting tension on these shortened hamstrings, thereby causing them to be tight and for the person to complain of pain in the hamstrings as well. And finally, the abdominal muscles, because of the forward flex posture, will shorten over time. And so those muscles are constantly under tension as well, and they will cause pain in the anterior aspect, in the hip flexors, which are shortened because of the forward flex posture. The positions of all of these various muscle groups contribute to the overall constellation of pain symptoms that the patient will complain of. Interestingly enough, patients are often taught to stretch the low back muscles because their low back muscles are tight. However, we see here that this is not really the problem because these muscles are already stretched. These muscles need to be shortened and they need to be strengthened, whereas the hamstrings and the muscles up the hip flexors are the groups that need to be stretched in order to address this constellation of symptoms. Having said that, this is a perfect time for us to take another movement break and to do another couple of exercises to get our body moving and once again feeling nice and supple. Okay guys, welcome to movement break number 4. So now we're going to do some standing stuff. We did a little bit of sitting stuff in the previous break, but now we're going to do some standing stuff, and we're going to also introduce a little bit of balance. So the first thing that we're going to do is a shoulder rotation against the wall. And the reason why we're doing that is so that we can try to force ourselves to be really strict about our range of motion. We want to try and isolate the shoulder and not be moving any other joints. So this is, so basically you're going to be about a step or 2 or a foot or 2 away from the wall. The closer you are to the wall, the harder this is going to be. We're going to try to engage our glutes, squeeze our butt cheeks, lock down everything so that nothing else moves but the arm that we're moving. You can keep your hand against your belly, you can put it at your side, you can hold it tight, but basically we're going to take the other hand and we're going to start this way, and we're going to reach up, palm towards the ceiling, bring it up as high as we can, straight, 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 then turn it around at the top to reach back, and then back behind. We're trying as much as possible not to allow ourselves to turn towards the wall, and we want to pretend that the wall is lava. So if we come back from behind, again, we're all nice and tight, reach back behind, and then reach and turn. One more time, each direction, up, 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 reach, 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 and back, and then one more time, Then we want to switch to the other side. Same thing on the other side. Reach, reach, reach. Try to keep the hand off the wall. So we do a few rotations in each direction. Okay? Now that we've done the shoulders, we haven't really done that much for range of motion of the lower body. So here we're going to do the same thing, but this time we're going to do it with the hips. And for this, you may need to use the wall or the back of the chair for balance. So if we're going to do the hip, we'll put our hand on the wall for some balance, just so that we don't fall over, because we want to concentrate mostly on the rotation and not so much the balance. And again, we want to make sure that we're engaged through the core and through our glutes, through our hips, or through our thighs, I should say. And then you're going to bring your knee up, out, back, and around for one full rotation. Out, back, and around. Out, back, and around. Out, up, back, and around. Now, so that's one direction, so we're going to go in the opposite direction, same thing. So here, we'll start back, out, back, all the way up as far as you can, out and up. And one more time. Both sides. Up, out, back, and around. Up, out, back, and around. Up, out, back. Reverse. And down. So that's the articular rotation of the hip and the shoulder. The last exercise that we're going to do for this movement break is the ninja squat. So from this position, we're going to sit with our feet about shoulder width apart. And all we're going to do is we're going to come up on our toes, and we're going to stay on our toes through the whole movement. We're going to come down into a squatting position, making sure that our knees don't dump in, just keeping the knees out, down to the bottom, and then push through the base of our feet up all the way back to the standing position, and then back all the way down again, driving the knees out, down to the bottom, push through the base of the feet, and one more time, all the way out, and back up. So you could do 5 to 10 reps of that, and that will be the ninja squat. And you'd feel that in your thighs, you feel that around the knees, throughout the calf muscles. That's a great exercise for working everything in the lower extremity and for waking it all up. So that's all the exercises for movement break number 4. We're going to get back to the talk now, and we'll see you for movement break number 5. So at this point, it's really important for us to ask ourselves, how much time do we spend sitting throughout the day? How much of our time is actually inactive? Even if you are somebody who works out every day and you work out for 1, 2, or even 3 hours of vigorous intensity, when you compare that with the amount of time over which you are sedentary throughout the day, you start to see the magnitude of the problem. If you consider that half an hour is 1/50th, or well, about 48th of the overall length of the day. When you work out for 2 hours, you're basically only working out for 1/12 of the day. 1/12 of the day. And when you compare this with the amount of time that you can be sitting or in a laying position, the average person sleeps from anywhere from 6 to 8 hours, and then you sit down to eat breakfast, and if you drive to work, you sit on your commute to work. While at work, you would sit at your desk, then you sit during lunch, and when you go to the washroom. When you go back to work in the afternoon, again, you're sitting at your desk, and you sit to have your evening meal. If you sit down to watch any TV in the evening, then again, you're adding more time to that tally of sitting or sedentary time. Over the course of the day, this amounts to more than 15 or 16 hours of sitting opportunities or sedentary activity, as opposed to only 2 hours of purposeful activity. And for most people, it's even less. So you start to see and start to understand why exercise and prolonged sitting are independent variables. They work on the body by different mechanisms, and their effects on the body are independent of one another. So let's just take a moment to consider standing desks. Because a lot of people say, well, no problem, I'm going to stop sitting and I'm going to stand and use a standing desk, and I will do that. And that will counteract this problem. So if you replace a sitting desk with a standing desk, but remain stationary for an extended period of time at the standing desk, you have only marginally improved the problem, because it's the prolonged inactivity that is the major culprit, not just the sitting position, although that too is a problem as well. Prolonged standing in a stationary position is also associated with a number of musculoskeletal complaints, and I've listed a number of them here. So while we're on the topic of standing, let's do a number of exercises that you can perform in a standing position. So hey guys, welcome to movement break number 5. We're going to introduce a couple of additional exercises that are going to work on flexibility of the lower extremities and of the spine and of the back in particular. So the first exercise that we're going to do is a angry cat, okay? And for this one, you're going to be using your chair. Basically, you're going to be using the back of the chair. And all we're going to do here is we're going to stand with our feet shoulder width apart, and we're basically going to pretend that someone has put a hook into the middle of our spine and is bringing or pulling that spine towards the ceiling. And all we're going to do is protract the shoulder blades. So bring the shoulder blades around to the front of the chest as much as possible and push the upper back up, 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 and away. And then relax. And then again, up, 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 push, push, push. And really try to expand out your spine and increase the space in between each of the vertebrae as much as possible. And then relax. And again, up. And relax. You may find, if you have a little bit more flexibility, that you can do this down in a lower position. And again, the principle is the same, to reach up, up, up. You can even go up on your toes if you want, and then relax. And then a big deep breath in. And relax. So that's the cat stretch. The next exercise that we're going to do is basically an airplane or Superman, but really this is an RDL, Romanian deadlift, and it's a single leg exercise. And so there are a number of ways in which you can do this, but basically what we're going to do is we are going to hinge at the hip, and what we're going to start this movement with the leg that is coming off the ground. So basically you want to start with the leg that is coming up into the air, and you don't want to lead with your trunk. You want to lead first with the leg coming off the ground up into the air, and then your torso comes down to compensate. You can bring your arms out to the side to help with balance, or you can bring your arms out to the front. If you have your arms out in front, it'll be easier to balance than it will if you have your arms out to the side. So we're going to do 3 reps per side. Basically, it's going to look like this. Switch, And you want to keep the supporting leg. You don't want it locked out. You want to have a soft knee. So we'll come out. And on the supporting leg, even though the knee is soft, you should be feeling a nice stretch in your hamstring running down the back of the leg. So you would do a couple reps more, 4 or 5 reps on each side, and that's the RDL Superman or Superman or airplane. The final stretch that we're going to do, or the final exercise that we're going to do for this movement break, is a couch stretch, and this is working on hip flexibility and hip flexor and quadricep flexibility. So there are a number of variations, but we're going to do just an easy one that you can do in the office setting. And basically, all you're going to do is put the toe or the tip of your shoes or tip of your foot onto the chair behind you, and then we're trying to stretch and lengthen this line on the side where the foot is on the chair. So basically, we're going to reach with that arm up and then lean back. And we're trying to increase this line that runs all the way down from the tip of our finger all the way back to the tip of that same toe. And by lengthening that line, we're going to get a nice stretch through the hip flexor and quadricep, which have been tightened because of the seated posture. If you're more flexible and you want to have a deeper stretch, you can turn around and put your foot on the back of the chair and then do the same thing. And this is going to give you a deeper stretch. And we're going to try to hold that for an extended duration so that we can stretch all of those structures out. And ideally, if you're holding this stretch, we want to hold it for a minimum of 30 seconds, but if you are comfortable enough and flexible enough, you want to work your way up to holding that stretch for approximately 1 minute each side. And you would probably repeat that once or twice on each side for a few 2 to 3 reps in total for each side when you did that stretch. So that's the couch stretch, and that's the end of movement break number 5. And let's get back to the talk before I see you for the next movement break. So by this point, we've talked about things on the inside of the body, physiologic processes that you cannot see that are affected by prolonged sitting or prolonged periods of sedentary activity. We've also talked about a number of problems that you can see or feel that are also a consequence of prolonged sitting or prolonged sedentary activity. So by this point, I hope that you appreciate some of the wide-ranging effects that this type of inactivity has on your body. And I hope that you understand why you might want to consider changing the way that you work. So if you want to do that, what are some of the recommendations that may help you achieve this goal? First, it is important for you to try to develop a schedule by which you can interject movement into your day. And basically speaking, it's important for you to try to move at least every half an hour. If your work situation does not allow this, then moving every hour is the bare minimum. You should try to take every opportunity that you can to incorporate movement into your day. So if you need to call a colleague at work, rather than sending an email or getting on the phone, perhaps you could get up and walk down the hall to their office to speak with them. When holding meetings with colleagues at work, perhaps you could turn these into walking meetings. Take the stairs at work rather than the elevator, and when arriving at work by car, be sure to park on the far end of the parking lot so that you can walk farther to the office rather than the other way around. I noted previously that the function of our intervertebral disc is impaired over time as a result of decreased water content, and the same is true of our muscles as well. So it's very important for us to keep hydrated throughout the day by drinking lots of water. And I didn't say lots of coffee, lots of soda, lots of pop, or anything else. Lots of water. Our bodies are comprised of anywhere from 60 to 70% water, so the more water that you can drink throughout the day, the better. You want to avoid sitting in any one position for any extended length of time, and generally, 20 to 30 minutes is the time frame that we're talking about. If you have to remain seated for more than that length of time, you should try to change position every 20 to 30 minutes. And although I did say that a sit-stand desk is not a panacea and is not the solution to all, if you are able to use a sit-stand desk, then you should try to do so when possible, because it allows you to change the position in which you are working from time to time. And you should do that on a regular basis. You shouldn't just sit at that desk and you shouldn't just stand, but you should vary the position throughout the day several times. Oddly enough, you should set up your office situation to be inconvenient. As an independent medical evaluator, from time to time, I'm called on to assess patients who have been injured in the workplace setting. And as part of their medical package, an ergonomic assessment is often included. And an ergonomic assessment, which is basically an evaluation of the workplace layout, is a bit of a double-edged sword. Because on the one hand, a workplace can be set up in a way that allows an injury to occur after repetitive movements. But on the other hand, the ergonomic assessment is designed to produce a position in which the body is comfortable. And the more comfortable the body is, the less likely you are to change position, which is what we want you to do, to change position. So it's important that you set your office up so that you need to get up to do things. So for example, don't put the printer right beside your desk, but put it across the room so that when you print out something, you actually have to get up out of your chair, walk over to the printer to get it, and then come back to your chair. Because even the act of getting up, walking to the printer, and coming back is enough to allow you to change your position, get the muscles moving, rather than allowing them to remain in a static position for an extended period of time. And finally, you want to think outside the box. You want to try to do whatever you can to incorporate movement, even if some people might look at you a little sideways. At the end of the day, as long as you can really maintain your productivity at work, it's your health that matters. You need to do what is necessary to minimize your chance of chronic disease and to keep yourself healthy and moving well. So at this point, we're going to take one last opportunity to introduce some workplace movements. And again, this is not a workout, but rather this is an opportunity for you to introduce exercises into your day to help to counteract the effects of prolonged sitting, both physiologically and musculoskeletally. So we're back with the last exercise break, and now we're just going to do a bunch of exercises to finish off our movement session. So the first exercise that we're going to do is the ballerina stretch, and this is where we're working on some lateral side bend or lateral or side bending of the thoracic spine. And so for this one, you want to be approximately 1 to 2 feet away from the wall. The distance that you are away from the wall will depend on how much flexibility that you have. But remember, the idea here is to just introduce some lateral movement to the spine because we've been sitting in a static position for an extended period. And for this one, we're going to reach up to the ceiling. We want to, again, engage our core, engage our glutes, turn all of these on, grip the floor, reach towards the ceiling, and then we're just going to tilt towards the wall, touch and back. Touch and back. Now, the one thing that I should point out is that we don't want to push that hip away from the wall as we're doing it, so that we, in fact, bend at the hip as opposed to bending at the thoracic spine. We want to keep all of this movement in the thoracic spine, so we want to try to lock our hips in position and keep them entirely upright so that all the bending occurs above. So once again, up, touch, up. If you're a little bit more flexible, you can bring yourself further away from the wall, reach, touch, reach, and touch. Of course, we would do several repetitions on that side, and then we would turn around and do several repetitions on the other side. So that's lateral side bending, or the ballerina stretch. So the next exercise that we're going to do is a diagonal touch or a diagonal wall reach, and basically this is somewhat similar to the ballerina stretch, but now we're working on spinal extension, and we're adding a small element of rotation to this. So from this position, you're going to be about a foot away from the wall. Again, the more flexible you are, the better your balance are, the further you can be away from the wall. We want to make sure that we turn on our glutes and engage our butt, because this is how we're going to protect our low back from injury. So you squeeze your butt, reach to the ceiling, and then we're going to reach back and touch over the opposite shoulder. Up and touch back. Up and touch back. And you want to try to look back to spot where you're going to touch the wall. Same thing on the other side. Up, touch. Okay, and so that's diagonal wall reach. So the next exercise that we're going to do is the knee circle, and this is just something that we introduce so that we can help to lubricate the surfaces of the joint. While we're sitting for an extended period, our knees certainly will bend, or they will flex and extend, and so we can lubricate the main surfaces of the knee joint. But the knee also, although it's a hinge joint, it's able to do rotation, a slight degree of rotation, and a small amount of translation, sliding front to back or side to side. So we want to make sure that we can lubricate all surfaces of the knee joint. So the way that we're going to do that is we're going to bring our feet right together. We're going to keep our knees together. We're going to have a nice bend, soft bend in our knees, and all we're going to do is we're going to rotate around one direction and the other. And basically all we're trying to do is to get that fluid in the knees all the way around to the other side. So a couple of circles in one direction and then a couple of circles in the other direction. And you may hear a little bit of snap, crackle, pop as you do it, and generally that's not a problem as long as it's not painful, and that's just the patella as it's trying to track in the groove with the movement. The next exercise that we're going to do is probably one of the most important ones from all of these series, or all of this series of exercises, and this is a squat hold. In North America, we tend not to use this position a lot, and we tend to be less flexible. In other countries around the world, they use this as a resting position. So we're going to try to do a full depth squat, and we want to do this with our heels flat on the floor. So if you take your feet in a shoulder width position, or a little bit wider than shoulder width, you can angle them. They can be directly straight ahead, or they can be angled out to a small degree, but we're really trying to keep our heels flat on the floor. And for this, for the squat, as we come down into the squat position, we are really trying to actively drive our knees out over the outside edge of our feet. We don't want our knees to drop in, and we're basically going to come all the way down to the bottom of the squat and sit right in the bottom of the squat. As we're here, you notice that my heels are flat, my knees are really working. I'm working to drive my knees out. I can push them out, and we're trying to keep our spines upright. We don't want to completely tank in between. We want to try to be as upright as possible. While we're here in the bottom, you can move around a little bit. You can really work to get your hips down in that. You can move to one side, move to the other side. You can bring your heels up momentarily, switch positions. You can rotate a little bit or rotate, but we're really trying to get comfortable in this position, and we want our feet to be active at the same time that we're in this position. So we don't want our feet to cave in. Again, we want to try and maintain the arch of our foot and drive our feet out. As you come up from the squatting position, we don't want to just stand up. What we want to do is we want to push our heels through the floor and drive our knees out. So push the heels through the floor, drive our knees out, and that will bring us back to the standing position. But again, we're not thinking about standing up, we're thinking about driving the heels away. Although you end up standing up, the reason why we want to do it that way is because if we think about standing up, typically what happens is that people are going to pull themselves up over their planted foot using their quadricep and their hip flexors. But these muscles are not as strong as the glutes and the hamstrings. So we want to use the big muscles to do the work. And so the way that we do that is by thinking about pushing ourselves up. So when we push ourselves up rather than standing up, we tend to use the glutes and the hamstrings. So that's what we're going to do for that. So again, squat, hold, down, heels flat, knees out over the outside edge of the feet, and try to keep your spine upright. So for the next exercise, what we're going to do is we're going to do basically a variation of the windmill. And so we're going to take our feet and we're going to spread them in a bit of a V shape. And they're going to be relatively, probably 1.5 times as wide as shoulder width. We're going to, if we're reaching down to our left-hand side, we're going to push the right hip away from the direction that we're reaching. And we're going to reach down and hold the other hand up in the air, okay? So all we're going to be doing is down towards the sky, or down towards the floor. We are not going to slide our feet. We're just protract or pushing out the hip and coming back up. Reach down and back up. Reach down and back up. To go to the opposite direction, we're just going to change the feet in the opposite direction. So one out, the other side. And again, one hand up. One more time. And bring the arms back down and back to a neutral position. So the next exercise, we're going to work on our forearms, because we spend a lot of time at the keyboard and a lot of time with our wrists in a flexed position. So we want to make sure that we stretch out all the muscles that are part of the flexor pronator group. So all we're going to do here is we're going to work on some flexibility of the wrist and fingers. And to do that, we're going to bring one arm out. We're going to take the fingers, hold them in the other hand, and we're going to pull back. We want to do this with a locked elbow, so we keep the elbow nice and straight, and we're going to hold, and we want to hold this position long enough that we actually get a stretch. And for many of you, this position is going to be relatively uncomfortable, and a little bit of discomfort is okay, because that tells us that we're stretching out all the structures that are nice and tight. And ideally, we want to hold this position for at least 30 seconds, but if we can, we want to work our way up to 60 seconds. Okay, and then relax. Then on the other hand, same thing, bring the palm up, fingers together, and then pull back. And again, we would do this on the opposite side for approximately 30 to 60 seconds, and that's working out all of the muscles of the flexor pronator group, which help to do this and to curl your fingers. After we're done, you can rotate the wrist to deal with a little bit of the discomfort that you have, and just to get them rolling again. While we're working on our wrists, we're going to also introduce some additional wrist stretching exercises and wrist prep exercises. And these ones you can do on your desk. And so basically, there are several of these. The first variation that we're going to do is with our hands facing forward, index finger towards the 12 o'clock position, elbow is locked, and the eye of the elbow, or the antecubital fossa, is going to be directed towards the wall ahead of us. And basically, while we have our shoulders stacked over our palms, we are going to lean and bring our shoulders forward over top of the hand. We want to try to keep the hands relatively active as we do this. And you should be able to feel the stretch up again through the flexor pronator group of the hand, or through the forearm, I should say. And we want to try to keep the palm against the surface of the desk throughout the whole exercise. And again, that's something that you would try to hold as a static hold, but usually what we would do is pulse through this position 5 to 10 times, and then we would hold the last one for a static hold. Then we also want to make sure that we catch all parts of the wrist. So then we would take our index fingers and turn them towards the 9 and the 3 o'clock positions. Again, keep the palm nice and flat, and then we would go from side to side, working that, and even around the front, back and forth. And we do that for a few reps. And then finally, we would turn the index fingers towards the 6 o'clock position, keeping our elbows locked and our palms against the surface of the desk, and then we would lean back. So we can pulse through this position, 4 or 5 reps, and then on the last one, hold. And this time we're trying to bring our shoulders behind our palms instead of keeping them stacked over top. And the amount of, or the distance that you are able to lean back will depend on the amount of flexibility that you have in the flexor pronator group. Perfect. All right, and once again, when you're done, you want to roll these out just to give your wrist a little bit of a break from all of the stretching. So for the last 2 exercises that we're going to do, these are both going to be lower extremity exercises for flexibility. So the first one that we're going to do is going to be a hamstring stretch, and you can do that one standing in front of your chair. And basically, you're going to keep a soft knee on the supporting leg, so a slight little bit of bend in that knee, and then you're going to bring your other leg up onto the surface of the chair, or onto the seated area of the chair, and basically you're going to keep that leg nice and straight, keep the toes towards the ceiling, and then you're going to bend, do a hip hinge, and try to bring your chest down to your knee. We don't want to round our back. We don't want to round our back. We want to try to keep nice and straight, keep the hip hinge, keep all of the bend coming through the hip, and then you should be able to feel the pull down the back of the hamstring. And then again, we want to try to hold this position statically for approximately 30 to 60 seconds. You may need to hold on to a wall or something, or the back of the chair for balance. That's okay, because this is, we're working here primarily the stretch and not the balance component. All right, so we would do one leg, and then we would switch, bring the other leg. Again, soft knee on the supporting leg, straight onto the leg that we're stretching. Hip hinge. And try to bring the chest down, or the belly down to the leg, and hold this stretch. And try to breathe nice and easy through it. And try to feel the fibers loosen up as you spend time in the stretch. So that's the hamstring stretch. And finally, for the last stretch, we're going to do in a seated position. And this is just going to be a figure 4, where we're working on the short external rotators of the hip. So for this stretch, we're just going to cross over one leg across the other. And we're just going to try and keep the knee externally rotated. And we're just going to lean forward into the stretch. And you should feel that along your abductors and along the external rotators, which is the upper part of your glute on the opposite side. You should feel that there. And again, we'll try and hold this stretch for 30 to 60 seconds. And then switch. And the same thing. And it's not unusual for you to find that one side is more flexible than the other, and your ability to go deeper into the stretch is more on one side than the other as a consequence. But again, you're just working to relax, breathe through the stretch, and ideally you want to be in a deeper position at the end of the stretch than you were at the start of the stretch. So that is the figure 4. So those are all the exercises that you can use in the workplace to maintain mobility of your body while you are at the workplace. And These exercises are a perfect way for you to inject movement into your day-to-day routine. As I said, these exercises aren't really designed to be a workout per se. They're just a way to get you moving throughout the day, so that you are not spending an extended period of time in a static position. But once again, remember, the most important thing is for you to take multiple opportunities throughout the day to move and to get out of the static position, because the more you move, the better it's going to be. So that wraps up the sitting disease and why you must change the way you work. I appreciate your attention during this webinar. If you have any questions, be sure to write them down and let us know in either the feedback form or by email. And of course, don't forget to check the resource section, which we've included for you for this webinar, which includes both the sitting disease cheat sheet as well as some video resources with exercise tutorials for all of the exercises that we think are appropriate to use in this setting. Once again, thanks for your time and attention. I hope you found this useful. And as always, that's Dr. Chris signing off for Human 2.0, where we build better humans.